There is a little bit of a fear amongst the athletes that we're going to tell them to stop training. When your body has rebuilt the cells, like I just mentioned, those cells are very immature. They're just cells. They don't really know what type of cells to be and what to do. People forget that they've got the rest of their body to keep active. You know, they feel, oh, I've injured my hamstring, I have to rest, I can't do anything. But actually you can. It's just, again, just about thinking outside the box.
Welcome to the Visionary podcast, where we discuss science, medicine, physical health, and mental well-being. Most of us usually tend to do one sport only, and this lack of variety might lead to overuse injuries. For those unfamiliar with the term, what exactly is overuse injuries?
Sure. So it's kind of what it says on the tin, really. I mean, an overuse injury is when you really have overused a certain part of your body. So if a lot of your body parts are under a constant state of change. So your bones, your tendons, your muscles are all always kind of regenerating and growing and things like that. When you exercise, if you do a certain thing too much, so say for example you jump too much on one aspect of your foot, and you don't give yourself time to recover from that, you can be more prone to overuse injuries such as stress fracture, for example, where you can get tiny sort of little breaks in the bone because you've not given it enough time to regenerate afterwards, and you've really just impacted that one part or put too much strain or stress through that one part of your body over and over again. And that can make you more prone to overuse injuries such as sort of stress fractures, or if it's a tendon, then a tendinopathy, tendinitis.
Okay. So it's not an injury caused by an accident or a trauma, no falls, no twists, just strain over a specific part of the body over time. Exactly. Is that correct?
Yeah.
Okay. With that, is that what we call, obviously it's different, but it feels to me the same definition as osteoarthritis, because I have that too on my left foot.
Oh, sorry to hear that.
It's a wear and tear kind of thing. Is that the same?
So osteoarthritis, I suppose we categorise it slightly different to an overuse injury, but it can be as a result of overuse of a joint. So yes, obviously the more stress you put through the joint, the more the joint can wear down and cause osteoarthritis. So, I mean, the makeup of a joint is two bones that are kind of sort of, I suppose it's where two bones meet, and on the ends of those bones you have cartilage, as well as maybe in some joints like the knee, for example, you also have a layer of cartilage in between the bones as well. And this cartilage helps to lubricate the joint, but also helps to cushion the joint as well, and provide a little bit of kind of sponginess and cushioning as we put impact through the joint. Now with osteoarthritis, that cartilage is essentially been worn down, it's gone. So you know, in the knee, the meniscus wears down, then eventually the cartilage on the ends of the bones also wears down. And when it gets to a point that it's bone on bone, that's when you start to get pain associated with the osteoarthritis. So yes, essentially the osteoarthritis can be as the result of an overuse of a specific joint, but there can be lots of other things that can contribute to it. So for example, being overweight and putting too much weight through the joint is another kind of key risk factor for osteoarthritis, and having a previous injury in the joint.
Osteoarthritis aside, when it comes to overuse injuries, how do I prevent them?
So if you're doing certain sports, to make sure that whatever movement you're doing within that sport, that the proper technique is used, you know, either through coaching, or there are a lot of apps now that you can use to video yourself and, you know, make sure that you're using the correct technique. But obviously that does involve a little bit of knowledge from the athlete to know what the correct technique is.
So who watches that on the other side, AI or a proper coach who would give feedback?
So it can be a coach, for example, or it can be you as an athlete. So if you are quite knowledgeable about the sport that you're in and you know the proper technique that's needed, you can video yourself and then look back at it, and you can actually see that, oh, I can see my head is sticking out there when it shouldn't be. But obviously that requires an extent of, you know, self-knowledge. So it's very dependent on how confident you are in the movement that you're trying to achieve, and what it should look like, essentially. But yeah, certainly looking at biomechanics. I mean, with running as well, we see, you know, looking at footwear. Again, I'm not a shoe brand, and I'm not a running coach or anything like that. But certainly I know that, you know, trainers do have a mileage that if you overuse your trainers and they wear down, that your trainers can get looser, the material can break down. If you use them for too long, you lose the cushioning in the trainer, and you lose the structure of the trainer, which can also affect your foot biomechanics and make you more prone to injury as well.
Hearing you talking about taking a video yourself, I've always wondered how my plank in Pilates look like. And I can't know that. Yeah, that's a really good idea.
It's worth giving it a go, but it's worth just bearing in mind what, whether you can maybe show it to a Pilates instructor as well to make sure you're doing the right thing. Yeah.
Does the same idea of overuse injuries also apply to office workers who are hunched over the computers every single day?
Yes.
Yes.
Yeah. So if you're, again, desk use is a repetitive posture. It's a repetitive exercise if you're typing, for example. So given that, the majority of people might spend 8+ hours at a desk, it's crucial that, your posture is as good as it can be, and all your equipment is set up to be, as optimum as it can be for you. And I think it's definitely worth speaking, if you do have an occupational health department, to have a almost like a desk analysis, so that they can check that you've got the right height computer, the right height desk, the right height chair, make sure they've got whatever equipment you need to try and prevent problems with your posture, to help prevent neck issues, back issues. Even, for example, we're going more into occupational health and occupational medicine here, but even down to keyboard use and mouse use, the actual position we hold our wrist and our hand in to use a mouse and a keyboard is not a natural position for our hand. So if you rest your hands on the desk, just how would you normally have your hands?
Plop them.
Just sort of plop down. But as you see, your hands naturally want to rotate a little bit. So it's not normal for our hands to be like this. Whereas if you look at a mouse use, a mouse is the generic mouse that we use is designed for a hand that wants to be in that straight down position. So it's worth looking into, for example, I think ergonomic mouses.
Yes, they're expensive.
They're very expensive. But if you have problems with wrists or hands and you're using a mouse 8 hours of the day, it's worth looking into whether spending a little bit more money on something you use so much might prevent or help any sort of wrist problems you have. But again, speak with the occupational health department. And there are sort of even doctors involved in occupational health departments that can advise much better on this sort of thing. But it's worth just looking at which position your hand naturally likes to be in and trying to adjust your setup accordingly. The most common thing we see with desk use is quite a hunched position. So naturally, we, as if we relax all our muscles in our torso, our shoulders, our back, our neck, in general,
we extend the neck
this starts to happen. The neck extends forwards, the shoulders hunch over, the back flexes, so you're in more of this position. Over time, that can have a negative impact on your posture.
So what is the right posture then? I'm seated there.
Yeah.
I'm not leaned backwards because I'm in alert.
Sure.
I am trying to.
So I'm sitting
focus.
in a terrible posture right now. So really, a good posture is where you have your feet flat on the floor.
Both of them.
Your bum should be shuffled right to the back of your chair.
Okay.
And feel free to lean back against the back of your chair. But that should be the correct posture that you sit in.
And shoulders back and down.
Ideally, shoulders back and down, but over time, that will be hard. So it's worth setting reminders on your phone, for example, or have a little diagram at the side of your desk that just reminds you every so often to just roll the shoulders up, back and down. And even just doing that every so often will help train the muscles in our back to do this less often.
Yes.
But with that in mind, your eyes should be level with the top of your computer screen. So you're not like this and you're not like this either. Okay, so this is also something to bear in mind.
Like this.
Looking at the top of your computer screen. Okay. And the height of your desk should be so that, this is slightly high for me, but I'm not doing office work right now, should be so that when your hands rest on the desk, your elbows should be at 90 degrees as well. And you're not like this.
Yes.
Not like this.
Not lower. Yeah. And at 90 degrees.
90 degrees.
Okay. All right.
The best way to actually avoid this sort of posture is considering a standing desk.
Okay, so
And
you're
this
an
is also
advocate of that. Okay.
absolutely.
Are there any downsides for that, for standing for a long time? Or maybe this is the lesser evil?
Everything in moderation. I think, again, you've probably heard doctors and maybe nutritionists say that a lot, but everything in moderation. So I don't think it's too good to sit for long periods of time. Likewise, I don't think it's good to stand in the exact same position for long periods of time. Our muscles do tire. So if you stand in the same position for 8 hours, you will find by the end of those 8 hours that you are developing bad posture because you've been in that same position. So you might be standing on one leg, the other leg might be crossed over the other. You might start to kind of lean on the desk. So
put weight on one
I would advise
side
just
and the
changing it up, making sure you're spending a proportion of your time sitting, a proportion of your time standing. Make a conscious effort to move away from your desk when you can. Take lunch somewhere else. Even if you want to sit down for lunch, don't have it at your desk. Walk somewhere else and have it at a different site, or walk out somewhere and come back and have it. If the only option is to have it at your desk, walk away from your desk, go and grab your lunch, or walk around the block, or walk around the building if it's horrible weather, which it often is, and then come back to your desk. Don't just grab the lunch, remain sitting in the exact same spot, because this will all make you more prone to poor posture and overuse.
I'm now wondering, overuse injuries might imply overtraining. When does a healthy lifestyle cross the line into something concerning?
I think there are certain signs to look out for that maybe someone is over-exercising or overtraining. When you look at exercise performance, that's probably the first thing most athletes would probably recognize. Their fitness levels might be reducing despite doing more training. Their muscle strength might be going down. Their endurance might be decreasing. They might just feel more tired, feeling tired all the time, not having any points where they feel like they've got energy.
That's all due to overtraining?
It can be, yeah. Okay. Also, there's lots of different reasons why this can happen, but these are just signs of over-exercising or overtraining that people should be aware of if they are exercising.
Hi, I'm Hala, your host today. If you're enjoying what you see, please hit that lovely subscribe button. It would mean a lot to me and my team. Or maybe it's more now. We're still learning, we're still finding our feet, but with your support, we can build this channel. Let's take this journey together, one step at a time. Thank you so much for being part of it. Do you see lots of teenagers who are super excited about what they are doing? They are taking it too far or doing too much. They might actually hurt themselves.
Yeah. So I have seen it in general practice, but also personally as well. I come from an elite sport background myself. So I did. I was a gymnast for sort of 15 years or so, and then I did 10 years of cheerleading. And I've seen it both in myself actually, but also in a lot of colleagues or athletes that I've worked with as well. Certainly, you find that sleep might be disturbed. For example, sort of not sleeping as well, waking up in the night. It has an effect on your mental health if you're over exercising. Really? So you can feel more anxious, more irritable. The concentration levels are down.
Why would that? Because of over excessive cortisol in the body or something?
Exactly. So over exercising is a state of high stress. So we tend to find that the cortisol levels are higher in those that have over exercised, but actually a lot of other hormones have been suppressed. So in particular, but most importantly for sort of females as well, we find that the estrogen levels are lower, and the sex hormones are lower, testosterone lowers. So in females, you might find that your periods stop or become a lot more infrequent, more irregular. Men, you might find that because of lower testosterone levels, the lack of morning erections, difficulty getting and maintaining erection as well, can also be a sign of over exercising. So if you are experiencing any of these, we might find that your injuries go up, or the amount of illnesses go up. So you're getting ill a lot more often because your immune system's under stress. And that's also a sign of over exercising. I think if you're experiencing any of these, it's definitely worth going to see, your GP.
So how can I tell if I get a small niggle or like a tiny ache, when to stop and call it a day and when to maximize my potential kind of thing?
Yeah, so I think it's important to acknowledge a difference between a muscle burn, as in your muscles are working hard and benefiting from it, versus a muscle pain. So a pain where you feel something some patients describe a feeling of something going. So if their hamstring strains, then they feel that their hamstring suddenly goes, and they get a really sudden sharp pain in the muscle after a specific movement, and then it has an effect on their movement afterwards. So either they can't walk properly, they can't run properly, they have a limp. These are signs that are not conducive to normal kind of exercise fatigue.
But they also say no pain, no gain.
Yeah.
Is that a recipe for disaster or words of wisdom?
It's a very simple way of defining something, but any type of exercise you do is going to be slightly uncomfortable. Your body temperature goes up, your heart rate goes up, you get a little bit more short of breath. You might get a bit of muscle burn or muscle fatigue. So a little bit of discomfort, a little bit of pain is normal part of exercise. However, this pain shouldn't last. It certainly, after you stop exercising, you should feel everything settling back down to normal with time. Yes, 1 to 3 days later, you might get the DOMS, the delayed onset muscular soreness. Following this, and certainly with a bit of stretching, some light massage, some further exercise, this should settle.
Nicole, you work with elite athletes. I'm wondering how they are like. Do they behave differently when injured? I'm thinking if they are better at managing pain, or even worse at asking for help.
Yeah, so I work as a doctor with the national cheerleading team, and I would say that there are some differences in behaviours between elite athletes versus the sort of
mortals,
the general population, and it's very athlete dependent as well. But I would say that there is a little bit of a fear amongst elite athletes that we're going to tell them to stop training. We're going to tell them that they have to stop. You're not going to be able to compete next weekend. You're not going to be able to finish the season. There's always that fear in the back of an elite athlete's mind that's going to be the case. So I think because of that fear, there is a kind of
they try to put up with pain.
Yeah, they try to put up with the pain. Yes, or they downplay it, and there's a bit of a reluctance to come forward to a healthcare professional and say, my knee's hurting, or I got hit on the head earlier, and I think there's always that kind of worry there. And I think in general, because there is that ulterior motive with elite athletes to succeed and to win at the sport they are training so hard for. There is an element that they will put up with a certain amount of pain, maybe more so than the general public. But again, everyone's different. And I've also seen members of the general public that have come to me years later say, I've had this pain for years, but I've never really thought about coming in. And now my partner has said, you must go and see a doctor about it.
More about the injuries. I have a practical example here for you, please. Let's say someone pulls hamstring during their morning run. What should they do in the very first crucial hours after their injury so the injury doesn't escalate? Give us like a simple step-by-step guide.
I tend to go by there's a couple of acronyms that we can use to help remember the steps to take. The one that I like to use is called peace and love. So the first few hours to days after an injury, you're looking at peace. So you want to protect the area at all costs. So try not to do any more on it that's going to hurt it and harm it more. And then you want to educate yourself. So that's the E of peace. You want to
by calling my doctor.
Yeah, well, it could be calling your doctor. It could be if you feel what you've done, then a little bit of research on the internet. I'd always recommend sticking to either government or NHS websites. We know that they're reliable pieces of information. This is a bit of a controversial one, but the A stands for avoid anti-inflammatories and avoid ice. Now, this is controversial because previously it's always been a case of, take some ibuprofen, which is an anti-inflammatory, and add some ice. Again, we can talk about ice later on if you want to, but there's a thought now that when your body gets injured, there's an influx of blood into the area, delivering inflammatory markers and cells that is going to help to regenerate and to heal the bit that's become injured.
Okay, that's a positive step.
It's a positive step.
From the body.
However, that then gives you swelling, heat and pain in the area. The thought originally, back in the sort of 1980s, when ice started to become, we'd call it cryotherapy as well. It came to sort of light in the 1980s, I think by a rheumatologist in Japan, as a way of reducing pain and swelling associated with rheumatoid arthritis. And that's when ice started to become a bit of a thing. Now, it's great mentally because it helps to prevent pain. And obviously, as all those inflammatory markers and cells come into that area to help heal it, it gives heat. It makes the joint or the tendon or whatever feel warm, and ice helps to just soothe it. So mentally, we think that ice can actually help with pain. And it does. We still, a lot of people use it now, but there is a lot more evidence recently to say that actually it stops all of that inflammation. So ibuprofen is an anti-inflammatory. It helps to reduce inflammation in an area. However, it can slightly increase the risk of bleeding as well. And obviously, if we're reducing all that inflammation, we're reducing the delivery of all the cells and all the chemicals that are going to help heal that area. So in theory, it can slow down. So that's what the A stands for in the peace and love. But it is slightly controversial and there's mixed evidence there. And then the C stands for compression. So compressing the area, certainly after an ankle sprain, strapping the area, compressing it can really help. And it can also help sort of give the joint some protection and stabilization as well. So the E is elevation. So you're getting the joint sort of, or the problem kind of raised up if you can, and that will just help with circulation.
For the parents watching us now, I'm a parent myself, and I see my 9-year-old doing the most extraordinary things and the most painful looking things in gymnastics. What are the red flags that a child's activity has gone from healthy to potentially harmful?
I mean, first of all, I would say it's really easy as human beings. We tend to internalize and empathize a lot with what other people are going through. So it's very common for us to see something that someone else is doing and imagine ourselves in that position.
I can't.
And instantly we feel pain.
Or 10th of what she's doing, I would break a hip. I can't.
I think it's safe to say that if she's under the supervision of a fully qualified coach, that she has had the conditioning and the training and the gradual stepwise progressions to be able to do some of these positions. I would say in general, children are a lot more flexible than adults. So as we get older, our ligaments and our tendons tend to get much stiffer. And that means that we can't as easily do some of the positions that a younger person or a child can do. I would say when the training becomes more maybe too much, I think it's important to listen to the child. So if the child's coming home and saying they've got pain somewhere, particularly if it's in the same place and it's persisting, that's a bit of a red flag. I think keep an eye on the child's general demeanor. So obviously, assume you know your child very, very well and you know what her personality and her demeanor is like. I think if that changes and they start to become a bit more kind of introverted, a bit more quiet, a bit more kind of fatigued and tired, I think these are also red flags that they might be sort of overdoing it or overtraining. Again, increased illnesses, increased injury rates are also red flags to look out for as well.
Yeah, I've noticed that if I don't go for a brisk walk at least once or twice around the park before I run, I almost always end up with strained hamstrings, almost always. What should we do before any exercise and after, so we would hopefully reduce the risk of injuries?
Sure. I mean, I definitely recommend a good warm-up. I would follow a similar structure of warm-up before any exercise, and then it just becomes part of your routine then. I tend to follow or advise people to follow the ramp method of warm-up. So the R is for raise. So you need to raise your heart rate at the start, raise your body temperature, raise your breathing rate a little bit. This can be through sort of a very, very light jog, or like you mentioned, a walk first as you're starting to warm up your body. The A is starting to activate the muscles. So you're starting to activate,
like stretch them a
little bit, but I would recommend dynamic stretching. So
what does it mean?
So you've got when you come to stretching, you've got two types of stretching. You've got dynamic stretching and you've got static stretching. So let's take just think of an example. Is there a stretch that you tend to do?
Is there, before Pilates, for example, usually they do. This is a stretch. Ooh, I just cracked. Is this dynamic or?
So that would be a static stretch.
Static, because it's not moving?
Exactly. So you're not moving, and also that's quite a passive stretch. You are forcing your body into that position. And a dynamic stretch is where you are stretching your body but through movement. So if, for example, I wanted to stretch out my groin, so the inside of my leg, a static stretch would be doing a side lunge. So stepping out to the side and just holding that position whilst feeling a stretch down the inside of my thigh. A dynamic stretch might be doing what we call them hip rotations or gate openers and gate closers. So it's where you rotate. So you lift your knee up to your chest
and rotate
rotate out to the side, and then you rotate in. So they're more dynamic stretches, or as well squats can be a dynamic stretch.
No one likes those.
For example, walking lunges, also a very good dynamic stretch, for example, for the hip flexors as well. So it's worth just looking up some dynamic stretches that you find would help. But yeah, focusing with the big muscle groups. And then mobilize. So mobilizing the joints again through dynamic stretching as well. And then P stands for potentiate. So you want to go through some exercises that emulate the activity you're about to do. So if you're going to go on a run, for example, obviously if you think about a running motion, you are wanting to do, you're going to need to do some hip flexor work. So obviously with running, you bring your knee up as you run. So doing that as an exercise will be helpful. Slowly, and then gradually building up. So you are at running pace, and then running. If you're going to do a sprint, for example, start with a jog, start running quicker before you then go and do your sprints.
Yes. And do I stretch after the workout?
Absolutely. If you do anything at all, take 5 to 10 minutes after every workout to stretch. During exercise, most exercises involve your muscles contracting and shortening. With that, your tendons are contracting. You need to give time for your muscles to relax and stretch out the opposite way, because otherwise you're going to get very tight muscles. And that also makes you very prone to injury as well. So this is when, after the warm up, you would cool down slowly. So slowly bring your heart rate back down to resting heart rate. So if you've been sprinting or running quick, bring it down to a light jog before a bit of a walk afterwards. Let everything settle down. And then that was when you would do your static stretching. So that's when you would bring in the side lunge, for example, to stretch that inner part of your thigh.
So before workout, dynamic stretching, after workout, static stretching. Yeah. This third part of the workout, which is stretching or doing any kinds of activity after workout, I never do that. Because I was never told that I should be doing that. After I finished the run, go back home.
A key part of recovery. It's key. And it's probably one of the most important things, I would say, is finding a stretching routine at the end that you can cope with, that you're going to remember, and that you'd be happy to do every single time. Okay. I mean, a lot of people would have done some of these stretches in PE class at school, for example, but it's little things like if you're standing there, putting your heel on the floor out in front of you and bending.
I see people doing
your
that
leg, and you slowly try and bring your chest to your knee. That's going to statically stretch your hamstring. So it's things like that, making sure you're targeting whatever muscles you've been using in the exercise that you've been doing. So in running, really focus on the legs, and you want to cover your calves, your hamstrings, your quads, the inside of your legs, as well as your bum muscles as well. So your glutes, your hip flexors as well.
Is there a myth about injuries that you would like people to stop believing?
Yeah, I think on the whole, after an injury, most people don't rehabilitate properly.
Do I have to?
Yes. Yes. So if you take a part of the body, say you take the muscle, there's 4 stages to that muscle healing, and we have to rehabilitate to help with all those stages. So the first stage after you injure yourself is the bleeding phase. You're going to bleed into the area
internally.
Yeah, particularly with a muscle. It's a very vascular structure. You've got a lot of blood vessels and a lot of blood flowing through a muscle, so you are going to get some bleeding, which might lead to some swelling, some pain, some bruising in the area. You're then going to get a period of inflammation, like we've just discussed, where you're going to get a rush of all these chemicals that's going to really help to heal the tendon itself. And then we've got what's called a proliferation phase. And that proliferation phase is where your body is building the blocks back up, almost like putting, when you're building a wall, for example, putting the bricks in place to build a wall, your body's building cells back up to heal that structure that's just been damaged. Okay, so that's the proliferation phase. And then the fourth stage and the final stage is the remodeling phase. Now, when your body has rebuilt the cells, like I just mentioned, those cells are very immature. They're just cells. They don't really know what type of cells to be and what to do. So the remodeling phase is where the cells learn how to do the job that they did when the tissue was healthy. So if, for example, you're building back a muscle, those cells need to learn how to contract, in what way, how quickly. And the only way they can learn is by exercising and going through very controlled movements to relearn, so that muscle can relearn how to do its job. I'm just using a muscle as an example, but the same goes for the skin. If you cut yourself and the scar tissue grows back, quite often it's stiffer and more sensitive. So you have to almost teach it how to do the job it once did. But this is a phase that a lot of people sort of forget about, and they think, oh, I'm healed now, I can go back to what I was doing. But they've not gone through those rehabilitation exercises that help build the muscle back up, because not only has it got new cells that is making up the muscle that's been damaged, but also the muscle that you once have has become deconditioned. So it's lost its strength, it's lost its stamina. So you also have to retrain the rest of the muscle and the rest of the body to be as fit as it was prior to the injury. But one thing that I touched on before was the peace and love. So the peace is the first sort of few hours to days after an injury. The love I use weeks after the injury. So the love stands for load. So you need to load the area again. So put more stress and strain and work through the joint gradually. I say the joint, I mean sort of that refers to any body structure that's been damaged.
Yes.
The O is optimism. So try and stay as positive as you can. Just because this moment in time you're injured, you can't quite do as what you once used to be able to do. Think about the bigger picture and keep that optimism in mind that you will be able to get back to the same kind of fitness level you were at. You just need to do the rehabilitation properly. The V is vascularize. So like I mentioned before, we were trying to avoid cutting off blood circulation to the area using ice and anti-inflammatories. Well, V is vascularized, so we want to encourage blood flow to the area, and this can be through heat, through massage, through using the area and exercising the area. All right, and then E is exercise. So not only exercising gradually, building up the exercise levels to where we once were, but not forgetting that you've got the rest of your body to keep fit. If you've injured your hamstring, you've still got your upper body that you can exercise throughout the injury. So even when you're in the resting phase at the beginning, you can still be doing upper body exercises. You can be exercising the other leg. People forget that they've got the rest of their body to keep active. They feel, oh, I've injured my hamstring, I have to rest, I can't do anything. But actually you can. It's just, again, just about thinking outside the box.